Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In this video, a vaccine update, and what's been our experience in Haywood County to date with the vaccine? What sort of side effects have we seen so far? And what about the new variant everyone is talking about and the effect it may have on vaccine effectiveness? So please share this video with someone you care about. In Haywood County so far, there have been around 1,000 people who have gotten the vaccine. So far, of these 1,000, there have been no serious reactions. Lots of sore arms and a few who have felt cruddy afterwards for a day or two, but no long-lasting effects. So what does the vaccine mean for Haywood County? Well, let's run some numbers. The listed population of Haywood County is 62,000 people. So far, we have had 2,433 cases as of Wednesday. That's a 3.9% of the population has been infected. If we assume that 5 times that number have actually been infected, that's a conservative number given what many epidemiologists have suggested. That means there have been around 12,000 people infected. So 62,000 minus 12,000, that's around 50,000 in the county who have not yet been infected. And at the current rate of 3.9%, we can anticipate another 1,950 people infected, at least that we will know about. If we think about that 5 times estimate, that's nearly 10,000 more. So let's just say, for example, that everyone gets vaccinated, meaning all 1,950 had been vaccinated along with the rest of the population. Then, out of that 1,950, only 98 would get ill. And if they had not been vaccinated, if no one had been vaccinated, then 1,852 would have. That represents the 95% reduction in illness that we saw in the trials of both the available vaccines. 98 versus 1,852. And with the current case fatality rate of 3.3%, that means 3 deaths if everyone was vaccinated versus 64 if not. 3 versus 64. Now, there's been much in the news about a variant virus first identified in the UK. And what does that mean for the vaccine? Well, the vaccines, the 2 that we have so far, use the spike protein on the virus surface and use that to stimulate an immune response. The variant has been sequenced, and there is not apparently any substantial change to this protein. This is why it is felt the vaccine should still be effective. And the variant has now been identified in 5 or 6 states, most recently in Georgia. In Haywood County, interestingly, we first noticed a change in our cases about 2 months ago, with what seemed like increased transmissibility and contagiousness, and a longer time to recovery for many not sick enough to be hospitalized. Was this because of the variant back then? Impossible to say. But it doesn't really change anything in terms of what each of us needs to do. Follow the protective measures, wear a face covering, keep your distance, limit the time with those outside of those you live with, and avoid crowds. And please get vaccinated when it becomes available to you. So be well and be careful, especially right now.